Dear students, today we will discuss about the topic biopharmaceutics and pharmacokinetics. So when the drug is given by oral route, for example, so the concentration will be slowly increasing and then take a peak value and then slowly declining. This is a typical blood level curve. So that means at zero time there will be no drug in the plasma, and as the time progresses, slowly the concentration will increase. That is because the drug from the dosage form administered will be releasing and then crossing the biological barriers and entering into the blood, and it continues. And as soon as the drug enters into the blood, the system will try to eliminate.
We know that nephrons are the basic unit of kidney, and when we say that kidney is injured or affected, that means the nephron is injured. The acute tubular necrosis, it happens in the glomerulus because of aminoglycosides, amphotericin, cisplatin, NSAIDs, and when we use radio contrast dyes. So these are the drugs which can cause acute tubular necrosis. The drugs which acts on the PCT, proximal converter tubule, and causes myoglobinuria. For example, statins, methyldopa, dapsone, and quinins.
In erythromycins, we see the general characteristics of this class. So this is the lactone ring made up of 14 atoms. Note that we have also counted the oxygen as part of the ring. The lactone ring may contain a ketone group at the 9th position. The lactone ring also contains two sugars. The sugar at the 5th position is a basic sugar, and it is disosamine with the D stereochemistry at the 5th position. The sugar glycosidically linked at the 3rd position is a neutral sugar, and that is cladinose. The stereochemistry at the 5' position is L.
When we talk about the benzene, it is an overlap of 6 pi bonds. How does a pi bond look like? Think for a moment, it is a pi bond more than 1,000,000 times magnified. It has 2 lobes. What are these lobes? These are nothing but electron clouds in the form of a wave function. There is a nodal point where there is no electron cloud. The real molecular model of the benzene, that is like this. You see, these are the 6 pi bonds above and below. They are totally delocalized, overlap with each other. This is how exactly benzene looks like. A framework model is shown. These are the two, this is above the plane, this is below the plane. They have an overlap, and we get a model like this.
Greetings to one and all. Welcome to this session on Parkinson's disease. Basal ganglia, as you all know, are a group of subcortical neurons which are present at the base of the forebrain. This basal ganglia consists of the cortex, the thalamus, as well as the brainstem. Here I have a diagram which shows all the different regions of the brain which are involved in this movement disorder. What are they? We have here the motor cortex, the striatum, the thalamus, substantia nigra, globus pallidus, as well as the subthalamic nucleus. All these work together, and there is a complex mechanism which is involved in the rise of the movement disorders what we are seeing.
Let us look at how glucose is systematically broken down to pyruvate. There is one reaction which is significantly positive. In other words, in case of this reaction, the tendency to go from here to here is minimal. The reaction actually is favored in the opposite direction, where dihydroxyacetone phosphate and glyceraldehyde 3-phosphate might come together to give you fructose 1,6-bisphosphate. Reactions which have a very significant negative delta G prime values tend to be irreversible in the direction of conversion of glucose to pyruvate.
When you think about study designs, the first thing that comes in mind is the research pyramid. So case series, case control, cohort studies, form association studies. The other two, randomized clinical trials and meta-analysis, which actually are causational studies, are considered to be experimental studies. So case studies or case series is just that. It's a series or patient cases that have come up either in the hospital or in ambulatory care or in a clinical setting. A subset of this could be considered to be cross-sectional design. So this is a one point in time study. So for example, if you give a survey to a group of patients, so that's considered to be a cross-sectional study because you're not going to follow it up. It's just done at that point in time, you do the analysis and you have your results, and the study is over.